Well, good morning. I'm sitting here with Howard Bracco. A lot of you know Howard as the former president and CEO and the founding president and CEO of 7 counties, a seat that he held for 33 years. And given the current turmoil that we're experiencing, I thought it would be interesting to get Howard's perspective on where we are, how things are evolving, and his take on some of the circumstances that have led up to that. So Howard, from your perspective as the founding CEO of 7 counties and somebody who saw 7 counties and behavioral health in Kentucky through a wide range of ups and downs, I'm curious about your perspective on the current situation, and are you surprised by it?
Unfortunately, no. This has been an issue in the making for a number of years, and one could see the trajectory that we find ourselves at today in this growing problem that unfortunately for years has been ignored. It was something that was easily foreseen, but obviously not easily managed. 7 counties over the past several years has looked at a variety of options, all of which were essentially shut down by the state, unfortunately. We recognize that the amount of contribution into the retirement program to sustain it was unsustainable in and of itself. And so some of the ideas that we had come up with was essentially to allow 7 counties to withdraw in terms of admitting new employees and creating a different benefit package for them while keeping the old employees in. We obviously sought additional revenue from the state, and as you know, we have not only not gotten additional revenue over the years, but actually with managed care, we face decreasing revenues, and that's a problem. So when you hit decreasing revenues and increasing costs that you cannot control, that's the problem that we face. Some of the things, again, that were attempted in the past, aside from withdrawing, we also worked with the state on developing a plan to increase Medicaid rates to cover it. Unfortunately, too late in the game, they learned they had to take that to the feds for approval, and I don't think there was a fire in the belly to get the problem corrected. So here's where we find ourselves today.
So over the last 5 years that you were here, and probably even more than that, it was pretty easy to see that this day was coming.
Oh, clearly.
And that 7 counties was really active in fighting the good fight in Frankfurt for a solution to this, but unable to succeed.
Well, unfortunately, that is the case. I mean, we got sympathetic ear, if no action, from legislators, and we had similar issues with the administration. And I think that, unfortunately, in a number of ways, people think magically that something is going to happen to basically change this without them taking appropriate action. This state retirement system is not the only one in difficulty. There are a number across the country. And we have been really late in catching up with the times. The state plan was a very good one for its time in terms of being a defined benefit plan, and these are virtually extinct across the country. It's not where the industry is going because it's, again, unsustainable. It's also been a strong sense or value within the organization to take care of its employees and to essentially try and assure as much as possible their future. And if we did not take action in regard to the retirement plan, it really puts people's future in doubt.
So, what advice would you offer to 7 counties, to our staff, and to the state around this current situation?
I think in terms of what is being done, number one, I would sustain that action because you have to demand attention. I think that this is a way to push the issue and break through the denial, and I would hope people, knowing how difficult it is, would support that. Secondly, I'd be looking at understanding the employees' needs, concerns, and obviously assuring that there is good open communication. And I think from what I've seen, that's pretty well been done. I think really making this understandable to the community, because this is a community problem, that in effect this organization provides so much good to this community, it's unthinkable what it would be if it did not exist, particularly for the vulnerable populations that we serve. And I think that, the organization is doing what it needs to do in order to assure the continuation of services to people. I think over the years, things change. During my course here, there was no end to challenges. This is a significant one. But I think that the thing that is important to understand is although things change, the essential values and purpose of this organization does not. And that we're all about having that going forward.
And protecting our ability to do what we do every day for the 32,000 people who come here
Clearly.
really has to be at the front of the conversation.
Mm-hmm.
Well, Howard, I really appreciate your making time to share your perspective, and I know you've been willing to give time over the last 6 weeks to be involved in some of this conversation, and you field questions about it around town. Even though you're retired, I'm glad we still have you around.
Well, I appreciate that, and obviously, for as long as the foreseeable future for me, my heart is still here.
Thanks, Howard.
Wishing you the best.